Education was always a keystone in our family, so it wasn't that I didn't have that support from home to want to go on to higher education. My parents, they both actually do have college educations. In fact, my dad has a PhD. However, what they didn't have was the tools to help me as their child to necessarily go off and start applying to colleges. I think what First Generation offers is a definite resource to students to really be realistic about what is possible for them in regards to higher education and to help them along the way. And so Mr. Fisher helped me understand, well, if you go to this Maryland school, well, this is what you can receive. In addition to the money that the school is offering you, you're also eligible for Maryland-based scholarships, which will help offset the cost that you'll have to pay. And so that was a no-brainer, and I pretty much decided to go to Maryland school. I kind of did want to go into the healthcare field, but I really wasn't aware of any other careers that you could pursue without, being a doctor or a nurse or anything like that. So after I took the personality test, this major, healthcare administration, came up. And I'm like, oh, well, what is this? And so after I got that information, I did a little bit more research and found the type of careers that I could pursue with that degree. And I just said, you know what, that's definitely for me. I work with the client to develop the satisfaction tools that they use to survey their patients who come for care in their hospitals. We also do research for the staff as well, so we conduct employee and physician satisfaction research, and also community research where we just call randomly to people's homes to ask about the hospital's image or a very specific topic that they're trying to get more information on. Then once the information is collected, I work with the client to view their data online, provide training, answer questions about the statistical information that they're getting back, and really just serve as that main point of contact if any questions come up. You have to be very detail-oriented, pretty much very organized. I think you have to really be somebody that's personable. You can't be somebody that's shy and can't talk to people. You have to definitely be an extrovert, I think, because you're dealing with hospital CEOs, executive VPs, directors. If you're somebody who's quiet, I don't think it's a job for you. Somebody who isn't good at multitasking, you need to really have that ability to work on multiple things at once, because I can have literally 15 or 20 projects going on at the same time, and I need to know where each of those projects is in the process and be able to provide updates to the client or, maybe people internally who need that information. Having the responsibility of making sure I know where the project is and the process can be trying at times, especially when you have to deliver bad news to a client that, oh, their survey didn't start on time or we're behind on interviewing because of this reason and that reason. I think my best day was today when I came back from vacation, because I left happy. I had everything in order, made sure all the issues were addressed before I left. And then when I came back, I didn't come back to an overload of work. The department I work in, we have a really great team that sort of helps each other when everybody is out. When I was in school, a lot of my peers were doing internships during the summertime, and I was working, but I was kind of doing like retail or, nothing serious. It was only in the last year, before my senior year, that I was required to have, one of my requirements for graduating was I had to do an internship. That was the only year, though, that I did an internship. I wish that I would have started out earlier, because I don't think I would have necessarily started working for HealthStream. I think I would have had a better chance of getting into a hospital if I had been doing more work with hospitals during the summer. My goal is to probably in the next couple of years move on to a hospital role. I'm going to go into a mid-level management position, hopefully, and then work my way up from there. If you know there's something in life that you want to do and you meet roadblocks and obstacles along the way, don't let that deter you from seeing it through. Because I think a dream that's not realized, is just something that's wasted. And if you have something in mind that you want to do, pursue it. And even if you don't ever get to that point, at least you know that you've tried your best and that you didn't give up.